with the Varanasi smart city to tackle it. And I am going to show you, sir, in the coming slides. And as usual, I will just start with a small 2.5 minutes video on COVID. So then I will take you through the slides, sir.
Sir, sorry to interrupt you. We have limited time, so try to finish in 50 minutes.
Yeah, yeah, it will be finished within 15 minutes, sir.
डॉक्टर वासुदेवन साउंड बहुत कम है
Sir,
साउंड नहीं आ रही है आपकी
sound. Is it okay, sir, now?
नहीं वीडियो में जो साउंड है वो बहुत कम है
Okay, okay. I think the video sound. Okay, sir. I think ऐसा करते हैं माइक से उठाए ना यार क्या कर दिया आपने you already have already restart मत करो हाँ बस फुल है ऑलरेडी फुल कर दिया हो यार ऊपर करो और इसे हराने के लिए संकल्पित है देश की सांस्कृतिक राजधानी काशी में जिला प्रशासन नगर निगम और स्मार्ट सिटी सहित तमाम विभागों ने समन्वित रूप से प्रधानमंत्री माननीय श्री नरेंद्र मोदी जी के संसदीय क्षेत्र वाराणसी को कोविड-19 के कहर से बचाने के लिए अनवरत मुहिम छेड़ रखी है। जिला प्रशासन ने अभियान चलाकर 7,91,000 लोगों से आरोग्य सेतु ऐप डाउनलोड कराकर उसे नियमित व्यवहार में सुनिश्चित किया है। जिले में हॉटस्पॉट और कंटेनमेंट जोन भी बनाए गए हैं जिनमें 41 सेलेक्ट जिले में बेहद कड़ाई से लॉकडाउन का पालन कराया जा रहा है। इसके तहत उल्लंघन करने वाले लगभग 2900 लोगों के खिलाफ कार्यवाही की गई है और बेवजह सड़कों पर घूम रहे 70,000 वाहनों का चालान कर उनसे 52 लाख रुपए बतौर जुर्माना वसूल किया गया। हमेशा गुजार रहने वाले काशी के घाटों पर सन्नाटा पसरा हुआ है और ऐसे में जरूरतमंद लोगों को भोजन की कमी न हो इसके पुख्ता बंदोबस्त किए गए हैं। 3 स्थानों पर कम्युनिटी किचन स्थापित कर 15 लाख से अधिक लोगों को फूड सेल के द्वारा खाने के पैकेट वितरित किए गए और साथ ही 62,000 लोगों को कच्चा राशन किट भी उपलब्ध कराया गया। लॉकडाउन की स्थिति में संपूर्ण शहर की बेहतर ढंग से देखभाल एवं आवश्यकता पूर्ति के लिए काशी इंटीग्रेटेड कमांड एंड कंट्रोल सेंटर में कोविड-19 वॉर रूम की मदद से 1,20,000 लोगों के ऑर्डर्स की पूर्ति की जा चुकी है। खाद्य आपूर्ति, चिकित्सा, नगर निगम एवं पुलिस विभाग से संबंधित 17,221 शिकायत
मेरे ख्याल से ये वीडियो चल नहीं रहा है आप प्रेजेंट कर दें
strategies, from citizen engagement to mapping hotspots, planning of quarantine centers to managing the supply chain for medical supplies and essentials. The science of geography has been a differentiator in containing the spread and saving lives.
Sir, so the video is over. I'm sorry for the interruptions due to the bandwidth. The first and foremost thing what we did, as soon as the lockdown was announced and the pandemic was declared, so the under smart city, so we have developed what is called a Safe Cozy mobile app. Safe Cozy mobile app developed by Smart City was the savior for the citizens of the city because it provided any and every information connected with the COVID-19 pandemic, sir. Daily updates, do's and don'ts, consultation to the doctor, door-to-door delivery, fruit and vegetable vending, issuing of e-passes, link to e-rickshaws, incident reporting, all government orders and voluntary contribution. And this is the what I've shown is the front interface, and this is the backside interface where our administrator used to monitor and update it on a daily basis. And we have also set up a dedicated helpline with 1077 numbers, and with an IVR systems, people could ring any particular number and reach depending upon their problems like a health issue. We also have a telemedicine, and the doctors were available at command and control center, uh, addressing the people on telemedicine. And we also engaged some UNESCO sponsored psychiatrists. We could go and visit the people who are in distress and psychiatric consultation wherever was needed. Distribution of ration and food packets were entirely managed, and all the municipal issues like fogging, solid waste management, spraying of the sanitizers were centrally monitored. The police was available 24/7, including the all lockdown, monitoring the lockdown violation, law and order issues, containment zones and permissions. All miscellaneous issues like agricultural and e-pass issues were also managed, and with this helpline. And we have received as many as 24,000 grievances from the public, and bearing few, all of them were successfully addressed based on the 92% redressal rate feedback we obtained, sir. So we have intensely used our geographical information system, and we have developed a number of digital dashboards. And that is, these dashboards cover every aspect of the COVID management, uh, be it is the suspects and the availability of the beds, the infection cases, availability of grocery and essential services. Everything was centrally monitored from our command and control room, which is renamed as the COVID war room. So, and we also do a lot of analysis based on this GIS thing about the proximity analysis, the heat maps. So these were good decision support systems for the district administration as well as the medical officer team sitting at the command and control room. So we have also survived, had the, we have already have a surveillance system, cameras installed all over the city, which were centrally monitored from our command and control center. And one of the views you see that post-COVID, uh, the quarantine centers view. And the lockdown violations and the video surveillance and the violation alerts were centrally monitored. The police people were all the time sitting in our command control center. We have developed and deployed some software solutions where the violations could be tracked and alerts could be sent to the police. And the hospitals also, the hospitals where the COVID-19 patients were admitted, we installed CCTV cameras, and they were also centrally monitored by the medical team and the police team sitting at the command and control center. You see a view of that below. Another important issue is the movement of migrants, and something like as many as 2.5 lakh migrants passed from Mumbai through Varanasi, and we have accommodated all of them here at the edge of the city, and given them provisions, given them medicines, treatment, and safely transported to their respective destinations. And we also installed mobile apps through which the entire process was monitored. We reached the city as organized as many as 1,100 buses, and the data were also collected where they could be skillfully employed. Community kitchens were established during the peak of the pandemic for providing food to the destitutes, migrant works trapped in different locations. These were also centrally monitored, and we set up cameras so that we keep monitoring how food is prepared, the quality, hygiene, the distribution network. So everything, our command and control center was a central point for managing the every activity of the pandemic, including the food distribution and community kitchen. We also engage a special team of quick response team for the sanitation needs. We also deployed drones. We are one of the first city to do that, because the drones were deployed to spray the disinfection, and even these activities of drone was monitored centrally through a mobile app, through a GIS app, and sitting at the command and control center, what is the area covered. So the inaccessible areas, which could not be done with the manual sanitization, we deployed drones with another unique thing, which Varanasi did, sir. And we have covered as many as 2,500 acres of sanitization using drones. As a part of our smart systems, we already have public address systems installed at 55 locations and LED signboards, and we put all these resources also at the command and control of the district administration to spread the message, the COVID-19 messages approved by the government, Ministry of Health, and ICMR were displayed, and frequent announcements were made both for the public as well for the police and health officials. Apart from other medium like movement of vehicles and putting portable hand wash systems and all that. Essential supply distribution was during the peak was a big challenge. So we have used both a GIS as well as our mobile app as well as our web portal to address this issue, and we have issued all e-passes to the eligible vendors, and we also analyzed through our GIS system what are the gray areas, which are the areas being covered. So the more vendors have been deployed, and the zonal offices were deployed to identify the gaps, so that each and every part of the city gets covered with the essential supplies and medicines like milk. Post lockdown, even the unlockdown, we have put all our resources put together, because in a gradual manner the unlockdown happened. So we need to allow the passes. So the vehicles, we use the smart city mobile app and smart city web portal to issue the passes. So no e-rickshaw puller or auto rickshaw has to ever go to the police department or anywhere. They could apply, submit all documents online, which was online scrutinized. Our smart city people helped the police and the district administration. The passes were sent to them using a link. They should download and print it. And for printing also, we enabled our smart city command control center, so the people could easily get their passes done even the post lockdown. So it was a very smooth operation. We have put all our ICT resources behind managing this. All this good work has been recognized. So Deloitte has brought a case study of the smart cities, and our city is very prominently figuring how Varanasi smart city has responded to the COVID-19 this thing. And also a Boston consulting group was commissioned by the Ministry of Housing and Urban Development. They also brought all the achievements carried out by Varanasi smart city. And not to mention that this has been duly acknowledged by none other than the Honorable Secretary, Ministry of Housing Urbans. So when he visited and he found these things, so he has tweeted. So Niti Ayog has tweeted the achievements done by the Varanasi smart city and how we handle the COVID-19 pandemic. There has been ample coverage of the news, print, and television media also, sir. So that's all my presentation, sir. I would like to take up your questions. Thank you. Any questions, sir?
Thank you, Mr. Vasudevan.
Sir.
You have mentioned about the actions taken by Varanasi Smart City, but what is the present situation? I can see that in your office masks are
Sir,
not
present,
necessary, it seems.
yes, sir. I think you will be pleased to know, sir, present situation is very good, sir.
Hmm.
And we have very less case. Today I have the statistics. We just have something like 56 cases only in the city. And we had a total of 23,477 cases from beginning to date. And out of that, 22,960 have been cured. And Varanasi, as when I say Varanasi, it is just the city. District has witnessed a of 456 people. I think we had with the pandemic very well and managed it. And right now the situation is very good. So we hardly have any signs of a panic among the people. So we are very comfortable situation.
So how
Immunization
much
has
of
been going on very well, sir.
how much of testing is being done now?
Testing. I'll get you the data. So I think we have done almost close to the national average as far as the testing was concerned.
No. I'm asking you now. Now that you mentioned that 56 cases only today. So are you testing now
Yes,
at
sir. Yes,
the
sir.
vulnerable spots only, or
Yes, sir. Only vulnerable. Yes, sir. Very few isolated packets where we find it. So the vaccination also now the vaccination has started because all the police people, health officials have been done. Even I have undergone the vaccination because
Acha.
I am considered as a frontline worker because we work in the command control center. My
Acha,
entire
acha.
smart city team has been vaccinated a few days ago, sir. So the vaccination is also making good progress.
Acha,
So
acha.
I think the situation is not. It's very encouraging in Varanasi, sir.
Acha. Is your whole team vaccinated now? Because you are not wearing masks, so I wondered that is it because that
Yeah, yes, sir. For the presentation, I removed the
no,
mask. We continue to wear the mask.
no, you are presenting, but your
Yeah.
colleagues are also at least not visibly wearing masks.
Yeah. My whole team is vaccinated, sir.
Acha, okay,
Entire smart city team is vaccinated. Yeah.
okay. And are you aware what kind of vaccine have you taken?
Yes, sir. Covishield,
Covishield, acha,
AstraZeneca.
okay.
Yes, sir.
AstraZeneca.
Yes, sir.
Covishield is
That is the
different.
Covishield. Yeah. Covishield is actually AstraZeneca Oxford version, sir.
Acha,
The Indian name is Covishield.
um, okay,
Other
fine.
one is Covaxin, sir.
Other one is Covaxin, right?
Covaxin, sir.
Yeah. Okay. Thank you. Thank you
Thank
for
you,
the
sir.
presentation. Yeah.